Hi, I'm Sarah from B Medical. Today I'm going to be taking you through the temporary mandibular advancement splint from Good Sleep Co. called Hushed. A temporary mandibular advancement splint is one that you can use to try before you purchase a permanent device. So it's a way for the patient to trial a device before they make the decision on whether a permanent device will be right for them. When you're thinking about the temporary mandibular advancement splint market or mass market, there's a lot of different devices out there, most of which are called boil and bite devices, which means you boil the device and bite it like a mouth guard to set it up. There's a couple of things that set the devices apart. The first one is the size. How big is that device and how easily will it fit in the patient's mouth? The second of which is it titratable? Can you adjust that bottom jaw forward, or is it just a piece of plastic that's sitting in the mouth? The Hushed device from Good Sleep Co. is a temporary mandibular advancement splint that's titratable, so you can adjust it, and it comes in two different sizes, the standard and the mini for different patient mouth sizes. When the patient first purchases the device, in the package and on the back of the package, you can see there's a QR code, and they'll scan that QR code on their phone to download the patient app called SleepCare. The SleepCare app will take them through how to set up the device, how to clean it, and any tips and tricks to help them get started. In the package, you'll find the temporary mandibular advancement splint. You can see the device here. You've got an upper and lower, and it's labeled on the actual device so you know which side goes up. On the side, you have two little push buttons here, and you push those buttons to move the bottom jaw forward. As you push the device, the first time it'll be a little bit sticky, but once you've done it once or twice, it'll move forward and backwards easily. You've got 10 different levels of adjustment here, so 10 millimeters of adjustment. And in order to use the device, the patient should start with it neutral. And as they get used to the device, they'll move it forward one notch each night, leaving a few nights in between to get used to the device so that it's comfortable for them and doesn't cause any jaw pain. So the first thing the patient does when they purchase the device is to download the app. The first thing they'll enter is their information and then connect to you as a clinic. And that allows you to be able to track how they're going over the course of their trial. Within the app, they'll first be able to see how you set up the device. So as we said, this is a boil and bite device. So it'll take them through a quick video on how to actually set up the device and do the boil and bite so that it's fitting properly in their mouth. The next section they'll be able to see is how to clean the device. So every morning when they wake up, giving it a good wash to make sure it stays in good condition. Next, they'll be able to see some morning exercises that they can do to make sure that they're not getting jaw pain each day. And the last section is how to adjust the device, so how to titrate it to make sure that it's working right for them and treating their sleep apnea. The thing I really like about this device is that after 30 days, within the app, it's actually going to start pushing and prompting them to take that next step. So whether it's to go back to their sleep clinic or whether it's to move to a local sleep dentist that's actually going to help them set up for their permanent device. Within the app here, you can see they can actually go in and select what's next. Schedule their appointments with their local sleep dentist, so that'll give them a selection of dentists that are in their area and qualified to make mandibular advancement splints, and set them up with their permanent device. So one of the things I always struggled with as a clinician when I was putting patients on a temporary mask was that I didn't know what happened to them. I wasn't sure if they used the device, if they went back to their dentist. It was really hard for me to know how to support my patient. So Good Sleep Co. has actually put together a clinician portal to help us track how our patients are going. Once your patient signs up with the app, you'll actually be able to see how they're progressing through their trial. So you can see, have they downloaded the app? Have they booked their appointment with the dentist for their scans? Have they gone and had their permanent device made? So it'll actually take you end to end through that whole service. So you'll be able to support your patients. So for example, if you saw after 45 days that they hadn't booked an appointment with the dentist, it might be a good time for you to call them back up and prompt them to either see the dentist or come back to you for another alternative. The temporary device has a 30-day warranty, so the patient can use it over the course of the trial, allow themselves enough time to find out if the device is going to be right for them, and then transition onto a permanent device with their local sleep dentist. For more information on Hushed or to become a stockist, contact your local B Medical rep or visit our online portal.